Good morning, all. Again.
Good morning, Sarah.
Hi, guys. Welcome in. Welcome. Hope everyone is having a good week and hopefully ramping down maybe for a day or two off. No, Reva's like, come on, Sarah, be real. That doesn't happen. Come on.
I'm just happy I have power at home again.
Yes.
We're celebrating that.
I know the storms hit real hard, so kind of doing a quick scan. I think I have most folks. So we will just go ahead and get started, and we'll take a quick break at 10, as Amanda mentioned. So just to reorient everyone to what we're doing, we are going to build, hopefully build at least one recommendation or action plan. And I have the template that I will pull up, and we can answer some of these questions together. I'm also going to drop the link, maybe I can figure out how to get there. There it is. To the Jamboard. It's also in your agenda as well for this particular subgroup. But there's the Jamboard link. It has a lot of our conversation over the last several months captured there. It is a lot of just notes. And then the workgroup agenda had at the bottom of it a couple themes that were pulled together based on our conversation, and I'm going to drop those themes in the chat as well. And apologies for the formatting in the chat, but I think you guys can see the little dots represent bullets on my Word doc that didn't, of course, translate very well. So those are the basic themes that I pulled together from our notes. And I think if one of those feels like something we want to pull the thread on a little bit more and turn into a formal recommendation, that's great. If we feel like there's other things that have come up that we really want to explore before we dive into making some decisions, I think that's the first thing I want to do. So I want to hold some space for other ideas that have come up since, particularly as we think about the conversation in November related to pending federal legislation, and we think about all the work that's gone on over the last couple months. So I will pause and give people space to share other ideas or thoughts that may be outside of those themes.
Well, I just wanted to give an update. There was a discussion, and I may or may not be making up this dialogue from this committee. I am on several committees, and sometimes you don't remember like what group you were having what conversation with. So I will preface all of this in stating that if this is the first time you've heard this conversation, then just work with me and pretend like you know and like you are very invested. And so I have, we were talking about, teacher parity during our last recommendations panel meeting, and they were talking specifically about licensed teachers. And one of the things that we had been working on as part of our strategic planning effort was figuring out what that parity would look like as we're looking at teachers that work with us compared to teachers that work with the district. What would we have to pay them if in fact there was going to be that parity that Dan was stating needed to happen across like all facets. But for us, because we partner with our school districts, we have licensed teachers, and there's like, okay, well, here we're year round, where the school district, they only work for 9 months. They have all kinds of benefits. We have a little bit of benefits, but we have benefits, but it's not the same as the school district. They have retirement, they contribute, but we don't match. I mean, like there's all kinds of stuff. And so we actually, our CFO worked with us to come up with like, what are all of the elements that we're going to look at, that we would look at if we were going to compare or consider pay? And I don't know if I can share my screen if we have the ability to do that, or I could just talk to you about what's on my spreadsheet. But if you're a data nerd and you want to see it, I can share the screen and show you, or I can just read it to you. But I
You
don't know,
should have
Sarah.
share. I think you should have share capabilities, Cornelia, and I think that's a great idea if you're comfortable sharing.
Yeah, I am. And so can you all see my screen? Okay. And so the first, what we did is compared, we were just looking at USD 259 and 260 because those are the two districts that we partner with and that we, I don't want to say compete with, but that people will leave us to go to those two districts and or we all pull from the same pool. Their base starting out, you can see the difference between 259 and 260 in terms of base pay. And all of this is just stuff we got from like the stuff they publish in terms of like their step pay and all that kind of stuff on their website. So it may be off from one year compared to another, but this is kind of a roundabout idea. So you'll see the difference in the pay. We have incentive pay here because we actually give an incentive to our teachers and they don't. And so that is, so that's what that is. We have the, their step and what those increases look like, the capers, the deductions that come from paychecks, due to capers, because that makes a difference in terms of their take-home pay, union dues, et cetera. And so this is like everything that we kind of put in and kind of compared all of the benefits, everything that's offered by the school districts, all the way down to gym memberships, with Derby Public Schools. So we looked at everything. On the right, is where it actually got a little interesting because what you'll see under USD 259 is the daily rate for someone that works at a school district as a new licensed teacher is $234.08 a day. And 260 is 236. And so if we average that, the daily rate is the 235.22. If Wichita works 190 days a week. Yeah, that's right. 190 days a year, and Derby has 184.5 days a year. We work like 200 and something days, and so 245 days. And so if we were to actually annualize the number of days that we work as a full year school versus the school district, the starting teacher who would normally start out with Wichita or Derby making $44,000 a year would need to start at making $57,000 a year in order for us to actually have the parity and pay them for the time, equivalency. Because if there's no, our teachers, for example, all start out at 44, just like they do. The difference is they work 12 months for us. And so if we were actually going to pay them, for the additional days, we would actually have to pay them $57,629. Well, obviously that's a whole lot to pay as a starting licensed teacher. And then that works its way up because then now what am I going to pay my assistant director and my directors and all of that kind of stuff if the teachers are starting out making $57,500. When we add in step pay, retirement, and the estimate of the health insurance, then we're looking at an annual salary of $66,000. And so this exercise was like, we all sat with our mouths open, like, okay, well, yeah, that was fun, but we don't have the money to do that, obviously, at all. But it was just an interesting, when we tried to pull it all together, just in looking at the daily rate and being able to pay people for working over the summer with us to encourage them to work with us versus the school district. That in itself was a very significant increase than what we're currently paying. And so, so I kind of wanted, because somebody in one of the meetings, somebody had said, when I told them we were trying to figure out what that would be, they asked if I could share what we were using to kind of come up with that calculation. And so this is what we have. It may or may not be perfect, but this is where we are right now. We're still working on this project and just trying to, you really kind of narrow the numbers down, but this is where we are so far. Questions, thoughts, anything? Oh no.
That's amazing. I love your spreadsheet and all of the information and gets at my kind of data nerd stuff. But I just want to say thank you because I know that was a huge lift for you and your staff to do that, but it's going to be very helpful for other programs and for other conversations moving forward. So
Okay, well, I'll share it. I'll
Great.
share it, so that people can see, whatever. I don't mind doing that. But yeah, it was definitely eye-opening. So yeah.
Any other comments or questions for Cornelia? I just echo Amy, Cornelia. That is really, really helpful information, particularly as we think about coming legislation and what pay parity means. And there's lots of really good things potentially on the horizon, but it's going to take more workers to do those good things. And this is the reality of what that recruitment effort might need to look like.
Mm-hmm. That's right. And as Dan was saying that, what they want is more partnership with community-based organizations and school districts. And, we've been living in the challenge of how do we get the teachers and that kind of stuff. And so and he actually said, parity means parity. When the question was asked, okay, what does it mean? And he said parity in all levels. Well, this is what that means, and that's a considerable amount of money. And it's not just the base pay, it's how it affects all of the pay for everybody then in the organization. Because again, I can't have a lead teacher making $60,000 a year, and then the director's not, whatever. I can't do that, how does that work? And so it really does make an interesting point. I kind of thought maybe I should have shared this with the whole panel in conversation, and I still can, if we want, but I just wanted to at least share it with us because unless I'm making it up, I remember us having this dialogue and wanted to share.
I will confirm you are not making that up. You.
We
definitely did talk about that, and there was questions about your process. So
okay.
So thank you
Very
for
good.
that.
Well, that makes me feel good. Thank you, Sarah.
Sarah, this is Reva.
Yeah, go ahead, Reva.
I am feeling a little stuck. I'm feeling like there's, this huge task in front of us and there's clearly work to be done. But in my brain, I keep saying, but what if that's in the federal act? But what if that's covered by the federal? And I don't know what we can do now to position us for what's to come. But it's this chicken and egg thing going on in my head. If we need to make a recommendation right now, what could we do that would position us well for what we hope is to come versus putting something out there that we're going to turn around and undo?
And Reva, I appreciate that because, I got.
Oh no, go ahead, Cornelia, go ahead.
Well, Amy, you had your hand up too, I'm sorry. Okay. And where I'm stuck, Reva, is, are we giving a recommendation for what we want to do regardless of what happens at the federal level? And so are we stating this is what we want to have as our state priority, or what the recommendation is going to be? And it does not matter what's happening, but this is what we want to say the state of Kansas needs to focus on.
I have some thoughts on that, but I'll let Amy and then Jen go.
Thanks, Sarah. So this is Amy Gottjammer. So my thoughts along as I'm listening to Reva, and that's all gelling with me. So what I'm thinking is, what if our approach was more towards the marketing and messaging campaign? That's something that we can do regardless of what numbers are out there or maybe out there in a month or two from now. Because what I'm thinking is, it will serve numerous purposes, because one, we need to educate. We just need to educate the general population about what we do, how important it is, all of that. A lot of people still think we're babysitters, right? So if we can start just sort of changing the narrative on that, getting people to realize how important it is, we'll get more support from the general society for, what we're doing in our, within our buildings. But they also might then start making noise with their own representatives, their state and federal representatives. It just might go, and with that, it could also encourage more people to be interested in teaching, to, bring more people, recruit more people into the field as they start to really recognize this as valuable, worthwhile work, right? So maybe it's something that we can do that just really helps elevate our position in general. And then when that money comes through, people will say, well, yeah, look what they've been doing. We're getting it now. We get it. This is important work. And then that might serve the purpose on a number of levels. So just a thought.
I think you're in my head, Amy. So Jen, go ahead.
Ditto. That was exactly what I was thinking. So thanks, Amy.
Kelly.
We make a great team.
Sorry, I had to figure out like all the buttons and unmuting and hand lowering and all that. Sorry. I love where this conversation is going, Reva, absolutely. And I think, we're all sort of feeling that like, well, all the what ifs that are out there. And maybe this group can focus on some of the stopgap thinking. So, we don't know necessarily what will happen with Build Back Better Act and what that will mean fiscally for the state of Kansas necessarily. But we do know that we have current funds through ARPA. And how do we think creatively on like shorter term stopgap measures to keep our current provider workforce, in the field and hopefully doing well, or at least okay, while we wait to see what the other developments might be at the federal level. And I don't necessarily know what that looks like. We do a lot of the sustainability grants directly to the program, but are there other supports we could leverage some of the funds we do know we have to support individual professionals on, in whatever way, shape, or form that looks like. And I know there's, lots of concerns about, wage supplements that aren't sustainable and things like that. And I definitely hear all of that, but what do some stopgap measures, what could they look like? How can we think about that as a group? Given just what we do know and what we know we do have to invest. So I don't know. I don't know that I offered any concrete solutions, but maybe that's where we can focus as a group.
Yeah, Amy, go ahead.
Yeah, this is Amy. So now I've got another thought. So supporting, if our work group is recruitment and retention, so the marketing and advertising piece supports the recruitment. But what Kelly's saying is if, we can come up with some places to put money we already have, then that would help with our retention piece. So maybe we can focus on both goals. We could come up with 2 recommendations, one each to support both sides of our focus.
Tabitha. Go ahead.
So this is just like a side thing because recently, so I work in childcare. Sorry, my husband's in there. So I work in childcare, and I recently discovered Casito offers CDA classes, and so I looked into it. I don't have my CDA, but I am director qualified, and so I decided I wanted to go back to school, get my CDA, and I found out that right now Casito offers a scholarship that pays for everything. That covers the cost of, the application, the classes and whatnot. And a lot of people don't know about that. So I shared it through, my company that I work for. But I think things like that help us because like my staff, when I told them that this was out there, they all jumped on it. They were like, yes, let's go, let's do it. And so if it's more out there for people who don't know about it, maybe, or there's things like that for people who would want to jump into the field, maybe that would be useful in the future too.
Thanks, Tabitha. Jennifer.
I was just going to say, I think Kelly's in the head of the National Head Start Association. I was just reading over something that they had sent out, talking really about, getting creative about using COVID relief funds and focusing on the workforce. So I think I'm in full agreement with that strategy. So we can position ourselves well.
Other initial thoughts? I think what I am hearing, and just I love Amy Gottshammer, your thought around both the recruitment and the retention side, and having a recommendation around both, and that the recruitment would be a messaging marketing PR campaign of some sort, and then the retention be more of either, I'm going to use the word stipend, using our current COVID relief dollars to do something for retention purposes for professionals or providers. Like, help me clarify. I know we have sustainability grants for owners operators, so would love some discussion around that. Yeah, Amy.
Get my button to work. Yeah, so on the sustainability grants, we had a wide latitude for how we wanted to spend that, which was great. I mean, I got the 60,000 one for my larger center, and I put 35,000 just into bonuses for my staff. So, but I know not everybody could or did do that across the state. So one thing that I've heard a lot, especially in regards to Build Back Better, is that it's great that all this money is coming, but is it going to reach the people in the classroom with their boots on the ground? Or does it get hung up at the administrative level in programs? So I think maybe with that in mind, if we could come up with something that specifically goes to individual providers, working in whatever across all settings, but individual providers with their boots on the ground.
That's great, Amy. Thank you. And I think that's the, we know that the 0 to 3 did a webinar on this. I believe it was 0 to 3, but we know that the federal, at the federal level, they're issuing guidance that says, please use your money to give to workers at the professional level. Jennifer, to your question, I do have a ballpark. Some of it's a little bit tricky because some of it's in planning purposes. But I think what would be millions is what I would say, Jennifer. So not thousands or hundreds of thousands, millions are on the table. And I think what this group could focus on is to think about, don't worry about the math necessarily. Think about what would be a meaningful recommendation that would support retention. And then we figure out the math in the work ahead before a formal recommendation is finalized, if that makes sense. Cornelia, you came off mute. Do you want to add to that?
You're very good. You just like watch everything that's going on.
I do. I'm scanning. Right. Yeah.
Like a little superhero power there. That's actually pretty cool. And so I ain't even like raising my hand yet. So along the lines, I mean, obviously recruitment is the issue, right? Because that's the reason we don't have all of our slots available or, classrooms open or whatever, is because of that. So is there a way to focus on pay? And some increased something that would go to providers either in, I don't even want to tie it to DCF revenue, because not all providers take DCF. And most providers limit the number of DCF slots that they have because of the amount that they get from DCF. And so to say increased pay from DCF doesn't necessarily impact everybody, because everybody doesn't accept child care subsidy, and a small number of their children, like we don't have a cap on DCF kids, but most do have a cap on DCF kids. And so that's not going to, that might not have the same impact as coming up with some other way to increase something that goes to providers so that we have the money to be able to sustain. So Amy, we did the same with our sustainability, and we said, okay, how do we give bonuses, or can we increase pay, or can we do something, because we're not filling positions and we've got to fill positions, and what do we do? And now we're like, okay, so now we have to come up with a plan to sustain this, because I can't give you the increase because I have this money and now the money's gone and now you're going to get a cut in pay, and so how do we sustain that? Because that's to me, that's got to be part of the recruitment message, is that there's got to be some way to increase the money, the funding that goes to providers, so that we can actually pay for the quality people that we want to have working in our centers. But again, I don't know what the plan is. And Sarah, you said don't worry about dollars and whatever. But I'm just saying that but to me, part of recruitment has got to be pay. because we're going to continue to have the hard times in filling positions if we're competing against everybody, that's now increased pay, to work at Walmart, to work wherever. And so yeah.
So one of this is a little bit of a double-edged sword, right? Like, so I appreciate Kelly's framing around stopgap, because the pay issue and a wage increase, you start to come into the benefits cliff, right? So we know a lot of professionals are receiving other benefits, and we've even heard from some that they don't want that they're nervous or anxious about a wage increase that would kick them off benefits, and then they're at a net loss. So I think the stopgap thinking, it might be better to think about this in the bonus or stipend situation versus an actual hourly wage increase. I know that's not the solution for long term, but again, if we think about stopgap, if we think about what's the universe we know we have now, I did say millions. We don't have, there's not enough money in our federal relief right now to increase wages across the board. Because to your point, we run into sustainability, we run into the benefits cliff, and there's just not enough money for all the professionals that we would want to give funds to. So just some extra considerations around that.
Well, you're right, and that absolutely happened. We're dealing with it right now because there's someone who received an increase and now has to move her children to her spouse's insurance, because now they were over the threshold to qualify for the benefits that they have. But that in itself is telling, because if our pay is low enough where they can qualify for state benefits, then that says something, and so, but you're right, it's a catch-22, and so I appreciate that.
Kelly, your comment in the chat around a recommendation to provide a waiver on that increased income and other program eligibility is really good. I know that we've mentioned that in we know some other states that have done that. We can certainly write something to that effect in. I think the waivers, depending on what the benefit is, right? Like the income eligibility comes from different places. So the universe of benefits that people would be receiving, their income is counted based on different benefit sources, right? So some of it could be in statute, some of it is just a policy change, that kind of thing. So definitely. I am just watching the time. I feel like we've sort of narrowed this down a little bit, and maybe a quick 10-minute break to stretch legs and go back and kind of clear heads and come back, and I will in the break time work on crafting these into something that we could start to write up. How does that sound? Okay, so 10:12, please enjoy. Okay, you guys are prompt, 12 after. Look at you. Thank you for that. Okay, so I have dropped these 2 items into our templates, which I'll share my screen here momentarily. I did want to offer 2 other thoughts around these recommendations. The first around the marketing and messaging. So we are the Child Care Systems Improvement Team, which is another member of our governance group, which many of you sit on or at least are aware of. They are making or leaning towards a recommendation related to a marketing and messaging or PR campaign, if you will, around the importance of licensed childcare and helping people understand some of the licensing elements. So just know that that is one thing that is also being explored. And then we know that our friends at DCF are also partnering with a marketing company through the relief dollars to cover a number of different things related to childcare awareness and activities that help get the word out about the different relief projects that are happening. So those are 2 kind of existing things related to messaging and marketing that we will want to make sure we align with so that we are, don't have 3 sort of campaigns happening at one time, but that these things are threaded together and really aligned. But I do think it's important to call that out as a recruitment tactic from the panel. So I'm not suggesting we don't do a recommendation. I'm just suggesting that we make sure we put alignment language in there and that perhaps it's 1 big one or 3 coordinated ones, et cetera. The second thought around retention, we'll call it pay at this point, for lack of a better word. That is something that is also being kind of discussed. So I think there's a real chance that should we get a recommendation together that has some X's and O's in it, that we can really, that can move. So I just want to offer some words of encouragement that this is meaningful work that you guys are about to undertake here, and that I know we said not to worry about implementation, that's a different step in the process, but I just want to encourage you guys that these are things that can realistically come to bear. And this is really important work over the next 40 minutes that we will do for that. So thank you. Okay. So I have, is there one that you would like to start with? I guess I should say that.
Let's start with marketing.
Thanks, Amy. All right. So I'm going to share my screen. It's a Word doc, so apologies. I would put this in a Google Doc and give you guys a link to it, but the some of the graphic elements make it a little bit wonky in when it turns into a shared document. So the way I think we could go about this, and you guys feel free to adjust me, but I'm just going to walk through some of the questions and things we want. You can say it out loud. Feel free to come off mute because I won't be able to see hands. So come off mute when you have thoughts, or put them in the chat. And I can also just pull your language from the chat into those questions. So this is your recommendation. So you guide me on how you want this to read. So I'm going to skip these first sections here, and I want to just start right into the formal recommendation. So this is the template that I believe Debbie sent in the notes. You guys have this template as well if you want to look ahead. I just wrote, this is the first thing we'll have to fill out. So the early childhood recommendations panel recommends that we have to identify both an actor and an action that we want that actor to take. I just threw in here, the state conduct a marketing campaign to recruit new childcare professionals providers. So correct me on this or give me some more feedback and guidance on the formal recommendation language.
Sarah, this is Amy. Do we need to, Amy Gotchamer, sorry. Do we need to specify, like you mentioned earlier, that there's some other campaigns already going on? Maybe I think you said DCF and I'm not sure who else. Would that be appropriate to put in there? Do we specify the state agency, or is just saying the state enough?
I don't know the answer to that because it's a little bit of a new process. I'm not sure, to be honest, Amy. I know the kindergarten transitions toolkit was a little bit more of an adoption, and this is more of a formal, like something needs to happen from the state level. So I'm sort of looking at Lisa and Jen too, because I know there are DCF folks here. I feel comfortable.
Oh, sorry.
No, go ahead.
Could we say align efforts to conduct a state marketing campaign or something along that line, or align with, I hate to use the word initiatives because they seem like kind of a short-term thing, but trying to think of an adjective there that would indicate that there could be other efforts that are in the works that we would coordinate with.
This is Rita. I wonder if that bullet under background information that says description of any additional connections, I wonder if that's the place where you could talk about, the coordination of other efforts, somewhere in there.
I like that, Rita. And I also think we can tweak these two over the next month. I think that's the next work of the next month and a half. If we go back, and this is the homework Debbie referenced, that we need to go back and maybe have some conversations with our state leaders and see if there is somebody that we could say, hey, we want you to take the lead on this particular effort. So. How do we feel moving to the background questions, which I think is actually probably the bulk of the work here. So I'm seeing a couple head nods from the 4 squares I can see. So Kim, Tabitha, Reva, and Kelly, you guys are in my 4 square right now. So just a heads up, no sudden movements. All right, description of how considerations, well, actually, I'll leave it up to you guys. Where you tell me what question you want to respond to.
Sarah, Amy, do you think that we have time, if we, rather than all going through every question together, that 1 or 2 people can just jump on each of these and then we can just put in the chat or something?
I think that's great. That's a great idea.
I don't know. I'm just thinking of divide and conquer. Maybe we can get it done more quickly, but I'm open to whatever. It's just a thought.
Can I get, how does everybody feel about that?
I think that's a good idea.
The expectation that all of these bullets are addressed, is that correct?
I think so, at least in some way. And again, it doesn't have to be perfect, right? We have time. This is just to get some thoughts down, and even to say, hey, we need to go back and do this. Like, let's identify areas we need homework. So one of the things I would suggest is, do we know the answer to description of how Kansas families have shaped this recommendation?
Exactly.
I think that's one where we either need to call out existing efforts that have already happened. We have talked to families quite a bit over the last 3 years, but is there something specific we need to do? So
I would suggest on that one that we go back to the needs assessment and we can see what some of, or maybe in the strategic plan, but I feel like in the needs assessment particularly, that was where results from the focus groups and everything that happened during that time was captured.
Love that.
I'd be happy to try my hand at description of who is impacted.
All right, Amy, thank you. Any volunteers to take on description of why this recommendation is important for Kansas early childhood care and education system? I feel like that's a little bit of a softball. If somebody wants to volunteer to write a couple sentences about that and just drop that in the chat.
I can do that one, Sarah.
Thank you, Reva.
This is Reva.
Sarah, this is Amy again. Do we have a description for what the issue is? Is the issue that we feel there needs to be more education statewide about what we do? Or is the, is the issue that we want to do the campaign?
I think the issue is the lack of childcare providers and professionals.
So it's the recruitment piece.
Correct. Yes.
Okay. All right. Got it. Thank you.
I could try to tackle that first bullet. This is Kim. How considerations of equity have informed this recommendation.
Thank you, Kim. Do folks want to drop a few ideas in the chat of the councils, committees, or work groups who would have expertise around this? I feel like that's a list. It might be good for everyone to kind of weigh in on who has experience or expertise related to awareness to recruit providers. Thank you, Patty. I know folks are thinking, but one other question. I think it's important that we identify a little bit of who we think needs to be at the table for implementation of something like this. My personal thought would be that we have a marketing company lead this. Perhaps that's Captain Obvious speaking, but I think it's important that we say, is it people around this table who are going to do that, or is it actually bringing on a professional in that field? I'm seeing head nods. Great. I'm just going to note that here.
Sarah, can we add KDHE surveyors to that list also?
Absolutely. Great call, Jen.
And I think the same with provider recruitment, provider Lisa Generette. What am I trying to say?
Whoops.
Um,
I think you're trying to say CCHCs.
yes. Oh, no, not the child care consultants, but then too.
Okay.
But I'm trying to say the subsidy folks, the provider enrollment specialists.
Oh, okay. Yeah. Provider enrollment specialist.
Or provider enrollment specialist or just DCF subsidy enrollment. Well, I don't know that it's specific to the provider enrollment specialist, but yeah. That was a lot of work to get that out.
It's worth it. Great job.
Sarah, this is Jennifer. I don't know if echo is a thing.
It is a
I
thing.
think it is a thing. Okay.
It's the 4-year, I believe,
Great.
unless I think it's the 4-year group and equip is the 2-year. So.
Okay.
I know equip is a little bit more active as far as is my understanding, but I think it's worth listing them both. So.
Okay. Acronym soup. Sorry. I just wanted to make sure
good.
it was correct.
Thank you, Lisa.
I think on the groups as well, having both CCPC and KSAYC.
I have one more question that I think is important for this group to weigh in on. And again, you can think about it over time, but is this something that we should tie to All In for Kansas Kids? That right now is kind of this, it's a little bit of a brand is what I would call it. Or is this something that should be separate, different, coordinated? Do we feel like there's equity in that to leverage it, or do we feel like it's adding another layer to something that should be more simplified?
I think anytime you can tie it into that, I mean, we talked about referencing the needs assessment, and the strategic plan is there to address that. So I think if we can say this is related to that, that is tied to that, I think that strengthens it. Just my thought.
I'm going to throw in my 2 cents worth here, and that's I have not been in the meetings with the new marketing organization that DCF has been working with, but I am pretty sure that they are also looking to, tying in with All In for Kansas Kids. I mean, just we've discussed we don't want to confuse the public. There's no reason to add extra if there's already something out there that's working, and it's such a great, I feel like it speaks to me.
It's helpful, Jen. Thank you. All right. I really, how does everybody feel about pausing on this and not pausing on this, but saying like, this is good for us to clean up? Because I think the other one, we can have some real good, deep conversations on logistics and things like that. So seeing some head nods. So I'm going to go ahead and save this. Stop share. And then share this one. Same process. Here is what I just kind of pulled together. Again, calling out the state. Utilize existing COVID-19 relief funding to provide stopgap retention, because I focused on retention based on our conversation, bonuses, stipends for individual child care professionals. anything in that needs to, any open for feedback?
This is Reva. It might be, oh, you just got it. Licensed childcare center. That's exactly where my brain went. Do we need to say that?
I think we do. I really think we do. And hopefully that's a tactic that can help people recognize, again, sort of subtly, the importance of licensed spaces.
Hey, Sarah, I might be jumping ahead just a little bit, but Child Trends just released a pretty cool report or summary of ways that different states have leveraged their funds to really get at equity. And maybe, I mean, I don't have anything that's jumping out at me because I read it a couple of days ago, which might as well have been a year ago. But there are some interesting considerations in there around how to specifically target different groups or communities. And so I just wonder if that's part of the research and planning process, is look at how other states have done payments like that, add-ons or differential payments based on the type of care. Like if you've got a provider that is working evening hours or weekend hours to provide non-traditional hours of care, maybe that is a different level of bonus. So I just want to throw that out there because there's some cool things happening in other states too.
You guys can see my thinking in real time here. Thank you, Kelly. And for this one, I did go ahead and add the explore potential waiver options, but I will add that from, I think it was SNAP that they were specifically talking about. I would like to, I guess I should say go ahead and drop the councils, committees, or work groups, even if you put it in the last one. Let's make sure we put it in this one. Anybody want to tackle description of who is impacted or why it's important? Thanks, Kelly.
This is Amy Gotchammer. I can try impacted again.
Thank you, Amy. I think while folks think about this, one of the things I'd like to do with this particular recommendation is, and I'm going to put it under here under additional connections within the system, but I really think it folds into the recommendation itself. I'd like to get you all's thoughts on who, priority, amounts. I really think it's important. Like, I think this conceptually, no one can argue with this as an idea, but when it comes to actually operationalizing it, how do we know the right amount that's meaningful? How do we prioritize? I mean, at any given time, we have, 16, 20,000 sort of affiliates, if you look at Claris, maybe even more. And so how do we prioritize, or do we prioritize? I'd love a conversation with you guys on some of that.
Sarah, this is Amy. Just in thinking of how I did my bonuses just recently, one thing one of the first ways I determined was by breaking them into groups of full-time and part-time, so people that maybe work 30 hours or 32 hours up, and those that work under, because like in Lawrence, I have a lot of part-time KU students and things like that. So the other thing is, and somebody else mentioned this, number of years in the field, I think is perhaps another thing, and the other thing we could look at maybe would be rewarding people that have tried to get, a CDA and associates, that, some sort of degree or credential.
With the last one, but is there a way to track that? Because I don't know, like Claris wouldn't be able to, I don't think Claris tracks that. So is there a way to track who has a degree and who has a credential without going further and like backgrounds?
You're right, Tabitha, that might be hard to enforce if we can't. Yeah, that's a good point.
Unless the money goes to centers, where then, because like we track education, for all of our employees or whatnot. And so does the money go, like, do centers apply for it? And during that application, they have to identify how many people they have with certain education levels or tenure, that kind of stuff. It might be a little more work for the center, but most of us know, like, how many degreed people we have or how many, whatever. And so that might not be all of that difficult.
If it's an application process, somebody, even if it's a family provider or somebody that it's working independently and they have a CDA certificate or whatever, if they are, maybe they're just required to scan it and upload it or mail a copy in or something.
That's good. Yep.
That is true. And I think a lot of centers, when directors would be willing to do that, just because, I mean, it's benefiting their employees, and, that's what we all strive for, is to, help our employees.
But yeah, if we are talking child hearing, you're right. The home providers, if they have a CDA or whatnot, they could submit their own application, for the stipend and upload their CDA. It might be a lot for someone to handle if all of the individual providers or teachers or whomever submit their own individual application. That's then processed by the state. That might be like really overwhelming. If there's 20,000 people in there that are all a teacher or an assistant teacher or a home provider or whatever, and they're doing all of those individual applications are uploaded so that then they can get a stipend. I don't know if we have a system in place where a computer could then figure out how much that amount needs to be and dish out a check, but otherwise that may be a lot of work for someone to have to kind of mull over and figure out. But what amounts would we give?
I was just putting in the chat a couple of links to Illinois and Alabama, who have done similar things. Illinois was up to $1,000. Alabama's was up to $6,000 for full-time staff and $3,000 for part-time staff, which, I mean, that sounds pretty good. I'm not sure how much 1,000 sounds like.
This is Amy. I think that one number to beat would be those signing bonuses that they could get somewhere else. You hear about somebody else saying you can get $750 or $1,000 if you come here. So we would probably want to at least match that.
What feels, I mean, of course, 10,000 feels great, right? But what feels like, those of you who've issued from your sustainability grants, like what's been meaningful? What's been like, okay, $300, okay, like, you know.
Well, some of my teachers, like I said, I had all of those different categories. I created a whole spreadsheet that was, a whole salary scale, but just for the bonuses. And so some of my teachers that have been here, maybe not quite 10 years, but have been here a while and in the field a while, lead teachers full-time, we're getting about a $3,000 bonus. And some of them were, in tears that, so they were very appreciative of that. And I had some that made even slightly less than that. And they were thanking me for not having to choose between paying rent or buying presents for their kids this Christmas. So $2,000 and $3,000 seemed to make a pretty big impact, at least on my staff.
We did not get that big of bonuses here. I think the highest we gave was $250, and I think that's throughout a few centers because I, associate with a lot of directors. So $250 was what we gave our staff. They were all happy with it, but I'm sure they would be even more happy with $2,000 to $3,000.
Think of a $2,000 bonus. In my head, it goes to that equation of $1 an hour more. So if you think about their hourly rate and what the difference between that hourly rate and making $1 an hour more for a full, so I would advocate for at least that $3,000 or $2,000 threshold if you really want it to feel meaningful.
I know that for us, we had increases that we did for our teaching staff. And initially, we just gave bonuses to our administrators as we worked to figure out what the pay increase would be for them. And at $750 for one of them, for example, that was kind of disappointing to them because this year has been a hot mess. And they have done everything to pull out their hair, and what they were in a director, but one of our administrative positions. And so when they actually had an actual increase in pay, that was meaningful. And the $750 bonus, they were appreciative. And so they didn't want to say that they, that wasn't the case. But the actual increase in pay is what they stated. Like with their face, I'm like, so we just gave you money and you're looking at us like we didn't just give you money, like what's happening? And she said, I guess I was just hoping for a little more. And so you trying to find that, what is the magic number that is going to be meaningful? And I like the word, that you used in meaningful. What is the number that's going to be meaningful versus, just here's a little something, because then it's almost like a slap in the face, if it really is going to be to let you know how much we appreciate the extra that you've been doing, during this pandemic.
Hey, Sarah, can you scroll back up to the very first part, the state will, just for a second?
Yep.
Utilize existing code to provide stopgap retention. Okay, thank you.
So I think we have 4 minutes. We have to go back to the big group at 10:50. Is that what you guys heard? Now I'm losing track. Thank you, Tabitha, for keeping me honest on this. How do we feel about these two? I know we want to reach some group. I feel like we reached a little bit of group consensus to even go down this path, but I just want to, do we have any concerns about the direction that these two are going?
I have just a little concern about this particular one, and that is because I've read the guidance on the relief funds over and over again. So what I'm going to do as my homework is to go back and make sure that we're not, that we're still following the guidance and the rules, and that we're still within the things that we are allowed to do with those funds.
Thanks, Jen. It's a great point. And thanks for sort of volunteering to help do that.
And I'll also run it past Michelle to make sure that,
Yeah,
because she is the expert.
So I feel like, or I guess I should hold space. Any other questions or thoughts? Okay, so what I'm going to do is I'm going to save these documents and email them to you guys after our panel meeting is over. And I think the work that our group has, and I'll try to facilitate this via email because I know folks are trying to get some much deserved time off over the next, well, I say that, but we know that the work doesn't end for early childhood folks. So being presumptuous there, hopefully you get a day or two off, but I know folks have lots of other things going on, but I would love to facilitate some emails back and forth to get these things to a place where we could come into the January panel meeting with really tight recommendations. And if we don't, we don't, right? Like, let's get this right. Let's not get this rush. But I think there is some urgency around both of these. So, excuse me. How does that feel to everybody? I know we don't need another meeting necessarily. Good, thumbs up. Okay. So I'll plan on
we
doing.
got a lot accomplished.
Yeah, you guys did. That's amazing. Kudos. And Cornelia, if you want to send me your spreadsheet as well, I'll include that to the group so they can have it, or you can send it to Debbie and she can share that with the full panel. So around the teacher parity, which I think is also really critical. Okay, I know Tabitha stepped away for a minute, but I'm gonna ask her to kind of lead the sharing back of these recommendations, but you all should feel welcome and invited to add flavor or commentary to where these came from.
Hey, Sarah, I just stuck in my section in the chat. So if you want to copy and paste
Awesome.
that, sorry, it took me.
Nope.
I got sidetracked with all the discussion.
I don't know how you wrote those and were active in the discussion, Amy. So I mean, the fact that you got anything is really good. Thank you. All right, I am releasing you back into the full panel meeting. Thank you so much. This is great work.